Diane Saterby. I'm one of the founders of American Institute of Alternative Medicine, and massage therapy is what we first started with here at the school back in 1994. What makes our program different? First of all, it was designed by massage therapists who are working in the field, it's taught by massage therapists, even our biosciences teachers, almost everybody is a massage therapist. So the whole program is very tightly put together so that you hear from massage therapists why they need to know the science, why they need to understand the pathology, what that means when your patient is on the table and comes in with a medical condition, and what does that mean you need to do to modify so that your treatment is tailored to that person. So one of the things I wanted to show is a little bit about our program. So in our classrooms, we've got document cameras. We have this thing over here on the other side of the room that's called an anatomage, and it's a virtual dissection. It's got a cover on it right now, but it's used in the biosciences so that it's virtual dissection. You get to see the layers. You're touching the skin layer, but what's underneath there? How do the pathologies mean you need to change your techniques, and you can see and visualize instead of on a two-dimensional book, you get to see kind of three-dimensionally. So it really accommodates all the different kinds of learners. So our program is 4 quarters, 2 days a week, and all you get is massage curriculum. Our goal is for you to come out and have a successful practice, not just pass your licensing exam. And what we do is we make sure that we repeat in different courses the material that you really need to master your head, with your hands, and with your heart. At first, it's easiest to teach your head. So we start out, so I'll use the document camera here. I'm not sure how it looks up on the screen. Doesn't look so good, it's too tiny. We start out with ethics. We start out with Swedish massage techniques. We know that you may have an interest in massage, but you probably haven't been doing it for a job. You probably only do it on some of your friends or family. But we break it down so that, like at first, how do you touch somebody? What is the way that you would approach someone so that they're comfortable, so that they're getting a massage and able to relax? Because your hands communicate things that your mouth isn't. So touch is the very first technique, and it's just touch, a connection without motion. You can gather information with your hands, and we teach you how to gather information with your hands. Stroking is the next technique that we're going to teach, and it's a very slow movement, a very light touch away from the heart, and it has physiological effects that are different than friction, which is firmer, moving towards the heart. We do kneading, and there's all sorts of different kinds of kneadings. There's kneadings where you pull the tissue away from the bone, or where you compress into the bone, where you're separating the fibers, where you're stretching the fibers, where you're compressing the fibers together elongatedly. There's percussion, there's vibration, and all of those are done individually. And we teach them so that you understand what it is you're doing with your head, because this is, as an adult, probably one of the first times you're learning how to do something that's a new physical activity, you know, like learning how to do a new sport, really. So your head is directing your hands. And at that point, you probably aren't even able to talk and move your hands in the ways we're telling you to do. You're really having to concentrate and make sure you're doing things right. With repetition, you end up not having to think about it. You get a muscle memory of what these techniques are. And so we're moving then into combining all those different techniques into a body part. So we start with each of the different techniques, and then we combine them into working on the arm, the leg, the back, the neck, the face, the head, the abdomen, chest, the hips. And we, that way, give you a series of techniques that you can do an arm, and you use all the different techniques. By the time we've taught all of those different parts of the body, you have about 3 to 3.5 hours worth of techniques in your toolbox. And then we say, okay, someone's coming in for a massage, they're gonna pull out their wallet, they're gonna trust you, they're gonna pay you to do a massage, and it's usually 50 minutes. So we teach you how to tailor your techniques from that toolbox of 3 hours to a 50-minute massage that isn't just about what's on the you touching that person on the table, but they come into your clinical setting, and how do you greet them? How do you talk to them? How do you learn about what the reason is that brought them to your office that day? And how do you help address, more than likely, their pain, dysfunction, stress, whatever reason it is that they are coming in to see you with. So then that's usually about 2.25 quarters into the 1-year program, the 4 quarters. You start working in the clinic, and you're practicing Swedish massage, which is for general relaxation. I mentioned most people go in and get massage because of pain or dysfunction. And so they've got some reason that they want you to help alleviate some physical pain. That is why we have 100 hours of neuromuscular massage training in our program. And we start out with teaching you how to assess their posture, how to assess their gait. And I promise you, it's kind of almost a curse, because you can't help but go to the beach, to the grocery store, to the gas station, and notice how people walk and stand, and what that means is tight, and what that means is getting overworked and causing pain in that person. So posturally, if you had a plumb line here on your third eye going down through your feet, you should be able to see the certain landmarks. We teach you the bony landmarks, that they're even and balanced. So you should be able to see through the thumb and the forefinger. And you can see I'm a right-handed massage therapist, so my pec is pulling my hand in. Is that showing up on the camera? Just a little bit. This side is completely balanced. This one comes in a little bit. You measure for, you can see maybe a difference in the gap between the arms, the distance between the ears and the shoulders on each side. The plumb line should go down and hit right between the ankles, the feet balanced. From the side, if you had a plumb line going through your ear, it should hit from your ear to your shoulder, your hip, your knee, and just in front of your ankle. So if people's head is forward, that means that their anterior neck is sore, which means that their posterior neck is sore, overworking, because it's holding up this 6 to 8 pound head, and they'll tell you the pain's here. If you haven't been taught proper neuromuscular approaches, you're going to go and say, oh, okay, they have a lot of pain here, I'm going to loosen up their neck. And what you're doing is really just loosening up things that are already overstretched and worked, and screaming for help and relief. What you really need to be doing is loosening up the front so that the opposing muscles let everything straighten back up. We have the neuromuscular in 100 hours. You end up learning how to massage every single one of the muscles in the body, and knowing when to loosen up a muscle versus when to not loosen up the muscle that's actually calling out in pain. We also teach you how to work with connective tissue, which ends up being part of the structure of the body that holds people in a position so that the muscles aren't, like you see people with really tight shoulders, and it hurts back here, but in here it needs to be tightened. And it's not that their pecs are tightened and working it so much, it's that the connective tissue has shortened and thickened, and there's techniques which are not the same that you use on a muscle to stretch and release and help fix that. We teach so that you know enough of the biosciences to more than pass the national licensing exam, the MBLEX, and every state uses, not every state, but most states use the MBLEX as a licensure exam, and then they have other things that you have to supply to the licensing board. Here in Ohio, it's the medical board that licenses massage therapists. But there's other things that they will need also. The business is another thing that you're going to need to know that isn't taught in a lot of schools, especially tailored to an individual practice. They just teach you general business, and they have you in a college course with a lot of other people in business. and that's not enough to work independently as kind of an entrepreneur. Another thing I wanted to say is the Bureau of Labor Statistics shows that right now, in 2017, the median pay was about $19 an hour, which is almost $40 a year for a massage therapist. And I know that people look and say, hey, you've got a one-year program, but I can spend a lot less money going to a two-year program, but you're not out there working. So if in year one, you're going to school, and then year two, you start making maybe $25,000, year three, you're making $25,000, year four, you're making $25,000, but you go to another school that you go to school for 2 years, so you make nothing in year one and two, and then you start out with $25,000. This is for like simple math. You never make up the cost of your lost earnings. Going to a program that's very short and concentrated to get your license gets you into the workforce a lot quicker, and you never make up for lost earnings. And that's just really simple math. But I hope that you'll come in and tour our building and talk to one of our admissions folk, because I've been a massage therapist for many years. I started out as an engineer working at IBM. I love this profession. It is a lot of fun. There are not enough massage therapists. All the employers are just begging us to like send our graduates to them. There's just not enough people. It's a great career. Come and see us.